My PhD addresses inequalities in children looked after in England. Children looked after have experienced adversity sufficiently severe for the state to remove them from the family home. We know that lifelong outcomes for these children are poor compared to the general population. Many will struggle with a range of outcomes: education, employment, income, housing, and health. Life for these children isn't just harder, it's also likely to be shorter. This is a major public health and health inequalities issue. And chances are you'll have seen images like these. I think they rightly focus on children's perspectives, but they also simplify. The parents seem to personify darkness. Certainly these images are just to react, intervene, remove. We have to react when appropriate, but I also want to make the case for child maltreatment prevention to keep families together. Although child welfare involvement is hugely stigmatized, it's also incredibly common. Taking the cohort of children born a decade ago, more than 1 in 5 were referred to social care before the age of 5. This is the tip of the iceberg. Many parents don't get a chance to parent. Across parts of England, around 1% of children are born into care. Early removal hasn't put a dent in care entry for adolescents, which has spiked in recent years. And in many cases, adolescents who leave care will return home. The reality is most parents love their children. Many struggle to cope and keep their children safe from themselves or others. The starting point of my PhD is that we need to consider the context, especially the socioeconomic context of families' lives. I started by looking at trends and inequalities in children looked after over time. In red are the most deprived areas, in blue the least. Since 2008, there's been a dramatic rise in rates and a widening of inequalities. Our models show that the inequalities increased independently of the effect of unemployment. The recession didn't cause this. What did? We have a couple of theories: rise in child poverty and cuts to services that help prevent child maltreatment. We investigated the latter, bearing in mind the different prevention services for different age groups. Within local authorities, cuts to services for adolescents were associated with higher rates of 16 to 17-year-olds entering care. We estimate that over the study period, 1 in 25 care entries in this age group were linked to the cuts. There were null findings for the 1 to 4-year-olds, interestingly. Early on, I started wondering how and whether this research could make a difference. So I've undertaken some qualitative work, interviewing so far 13 policymakers across 5 local authorities. We'll be analysing the data using a policy analysis framework, Kingdom's 3 streams framework. I'll be looking at problem definition, the political stakes, potential policy solutions that are circulating, policy communities, including whether there are any entrepreneurs looking to take advantage of windows of opportunity and what those windows might look like. Lots still to do, but for now, thank you.